Start the new year with the evergreen resolution to lead a healthier lifestyle. Here are 10 practical health tips to help you start off towards the healthy living in 2026. Eat a healthy diet. Eat a combination of different foods including fruit, vegetable, legumes, nuts and whole grains. Adults should eat at least 5 portions of fruit and vegetables per day. You can improve your intake of fruits and vegetables by always including veggies in your meal. Eating fresh fruit and vegetables and eating them in season. By eating healthy, you will reduce your risk of malnutrition and non communicable diseases such as diabetes, heart disease, stroke, and cancer. And the next is reduce salt and sugar. Reduce your salt intake to 5 gram per day, equivalent to about 1 teaspoon. It's easier to do this by limiting the amount of salt, soy sauce, fish sauce, and other high sodium condiments when preparing meals, removing salt, seasonings, and condiments from your meal table, avoiding salty snacks, and choosing low sodium products. On the other hand, consuming excessive amounts of sugar increases the risk of tooth decay and unhealthy weight gain. In both adults and children, the intake of free sugar should be reduced. WHO recommends consuming less than 5% of total energy intake for additional health benefits. You can reduce your sugar intake by limiting the consumption of sugary snacks, candies, and sugar sweetened beverages. And the third is fats consumed should be less than 30% of your total energy intake. This will help prevent unhealthy weight gain and NCDs. There are different types of fats, but unsaturated fats are preferable over saturated fats and trans fats. WHO recommends reducing saturated fats to less than 10% of total energy intake, reducing trans fat to less than 1% of total energy intake, and replacing both saturated and trans fat with unsaturated fats. The preferable unsaturated fats are found in fish, avocado, and nuts, and in sunflower, soybean, canola, and olive oils. Saturated fats are found in fatty meat, butter, palm, and coconut oil, cream, cheese, ghee, and lard. And trans fats are found in baked and fried foods and prepackaged snacks and foods such as frozen pizza, cookies, biscuits, and cooking oils and spreads. And the next is no smoking. Smoking tobacco causes NCDs such as lung disease, heart disease, and stroke. Tobacco kills not only the direct smokers but even non smokers, though second-hand exposure. If you're currently a smoker, it's not too late to quit. Once you do, you will experience immediate and long term health benefits. If you are not smoker, that's great. Do not start smoking and fight for your right to breathe tobacco smoke free air. And the next is physical activity. Physical activity is defined as a bodily movement produced by skeletal muscles that requires energy expenditure. This includes exercise and activities undertaken while walking, playing, carrying out household chores, traveling, and engaging in recreational pursuits. The amount of physical activity you need depends on your age group, but adults aged 18 to 64 years should do at least 150 minutes of moderate intensity physical activity throughout a week. Increase moderate intensity physical activity to 300, 300 minutes per week for additional health benefits. And the next is hypertension. Hypertension or high blood pressure is called a silent killer. This is because many people who have hypertension may not be aware of the problem as it may have not have any symptoms. If left uncontrolled, hypertension can lead to heart, brain, kidney and other diseases. Have your blood pressure checked regularly by a health worker so you know your numbers. If your blood pressure is high, get the advice of a health worker. This is vital in the prevention and control of hypertension. And the next is follow traffic rules. Road crashes claim over 1 million lives around the world and millions more are injured. Road traffic injuries are preventable through a variety of measures implemented by the government, such as long legislation and enforcement, safer infrastructure and vehicle standards, and improved post crash care. You yourself can also prevent road crashes by ensuring that you follow traffic laws such as using a seatbelt for adults and child restraint for your kids, wearing a helmet when riding a motorcycle or bicycle, not drinking and driving, and not using mobile phone while driving. And the next is take antibiotics only as prescribed. Antibiotic resistance is one of the biggest public health threats in our generation. When antibiotics lose its power, bacterial infection become harder to treat, leading to higher medical costs, prolonged hospital stays, and increased mortality. Antibiotics are losing their power because of misuse and overuse in humans and animals. Make sure you only take antibiotics if prescribed by a qualified health professional, and once prescribed, complete the treatment is as instructed. Never share antibiotics. And the next is clean your hands properly. Hand hygiene is critical not only for health workers but for everyone. Clean hands can prevent the spread of infection illness. You should hand wash using soap and water when your hands are visibly soiled or hand rub using an alcohol based project. And the last is having regular checkups. Regular checkups can find health problem before they start. Health professional can help find and diagnose health issues early when your chances for treatment and cure are better. Go to your nearest health facility to check the health services, screenings and treatment that are accessible to you. Thank you. Meet you the next day.